Good morning, viewers. I want to talk about diabetes this morning, which is also known as hyperglycemia. There are two types of diabetes. We have type 1 diabetes and type 2 diabetes. Type 1 diabetes is known as insulin dependent diabetes, whereas type 2 diabetes is known as insulin non-dependent diabetes. Type 1 diabetes occurs at all age. Even a child giving birth to today can have a type 1 diabetes because it is an autoimmune reaction. But we measure on type 2 diabetes, which is what we usually encounter in the clinicals. Type 2 diabetes is usually caused by lack of sufficient insulin, which is the hormones that carries sugar from the blood to the tissues. Normally, the blood is a medium by which oxygen and nutrients are carried to the tissues, and carbon dioxide and waste products are removed from the tissues and returned back to the lungs, whereby the carbon dioxide is exhaled and other waste product is excreted via urine and via excretors. So when this insulin is not sufficient enough, the individual develops type 2 diabetes. Normally, for somebody who is non-diabetic, the normal range of diabetes when checked with the glucometer. Glucometer is the machine used in checking blood sugar level. The normal range is usually 70 to 99. There are 70 to 99 milligram per DL, which is a deciliter. Whereas after the person have eaten, which is called, that one is called the random blood sugar, it is not supposed to be above 120. It's supposed to be between less than or equal to 120. But for people that have diabetes, their fasting blood sugar is usually between 99 to 120. That is when it is under control. And after they have eaten, 2 hours later, it is not supposed to be above 130. So it is supposed to be less than or equal to 130. Now, when measuring fasting blood sugar, it means that the person have not actually eaten. So the person measures it, and the fasting blood sugar normally gives more accurate result than a random blood sugar. And the range for determining fasting blood sugar is also different from the range for determining random blood sugar. For fasting blood sugar level, the individual must wait for at least 2 hours after eating before checking the blood sugar level. So the insulin, which is produced by the pancreas, the part of the pancreas called the the part of the pancreas called the beta cells. The beta cells. The beta cells, a part known as the islet of Langerhans. When there is a deficiency in this part of the pancreas, that is bound to be insulin insufficiency, which caused the blood to be accumulated, which caused the sugar to be accumulated in the blood. So the lack of insulin, like I said, is what actually gives rise to diabetes, or what is known as hyperglycemia. Then to manage diabetes, first of all, the individual must start with non-pharmacological means of managing diabetes, which entails that the person must change his or her diet. The person must reduce the amount of sugary substances that is taken, also reduce the amount of carbohydrates that he or she is taking. So it is better that the person eats like space the eating of, for example, when we say carbohydrates, there are foods like fufu, gare, rice, corn, and so forth, and so on and so forth. So it is better that the person space it. Instead of eating a large meal, it is better that the person space it for up to like 5 to 6 times. The person can eat up to like 5 to 6 times, because people that are diabetic, they usually feel this urge to eat almost all the time. And it's also good that the person cut down his or her consumption of fatty foods. So diabetes causes some complications, which rises from what is called diabetic neuropathy, which happens on the leg. You begin to experience tingling sensation on the leg. It means that actually nutrient is not getting to that part of the body. That is why when somebody develops injury in those areas, that the blood is not getting to the person, the injury will not actually heal, except the person manages the high blood sugar level, bring it to normal range, and also use antibiotics to treat the injury. So there are some people also that their blood sugar level can be so high that when these things happen, the injury, which is also known as diabetic foot ulcer, can be so bad that the person's leg can be amputated. We also have other complications, such as diabetic retinopathy, which causes blindness in individuals. Like, for example, in my years of practice, I've come across many people that have gone blind as a result of having a high blood sugar level, and usually they didn't know that they were having high blood sugar level because they don't check. But it is when these things start happening, like they start having disturbance in vision, blood vision. When they now go to the hospital, their sugar will be checked and they will discover that they are diabetic. And unfortunately, most of them develops complete blindness. So I'm bringing this information to us in order for us to ensure that we check our blood sugar level, especially if if it is in your family. For example, if your mom or your dad had it, because high blood sugar level also run in the gene, so it is genetically encoded. So it is very important that if it runs in your family, you ensure that you take precautions so that it cannot happen to you. It's not a must that it will happen to you because it runs in your family, in as much as you take precautions. There are other type of diabetes which I will not go into. For example, the gestational diabetes, which is the diabetes that occurs when somebody is pregnant. There are many other types of diabetes which I will not delve into. Let me just talk about the ones that we experience more in the clinic. So in managing diabetes, like I said, you manage your dieting. You eat more of fruits and vegetables, and you cut down on fatty food intake and sugary and synthetic sugary food intake. And for the pharmacological treatment, there are different classes of drugs that are used in the management of diabetes, which ranges from the biguanides, the sulfonylurea, the thiaoxyzolidine there are different kind of them. There are different classes of them. For example, I can mention their names. Drugs like glucophage, drugs like glanil, drugs like Gavos. Gavos is viragliptin. Drugs like pioglitazone, drugs like acarbose, and drugs like glyclazide, glipizide, and so on and so forth. The sulfonylurea, which the glibenclamide, which is the glanil, belongs to, they are actually very dangerous when taken in excess. When somebody is using such a drug, the person is supposed to be checking his blood sugar, because these things can lead to hypoglycemia, which is more dangerous than hyperglycemia. Hypoglycemia means that the sugar has gone so down that the person will start feeling dizzy, and it can lead to coma. And it is not good for somebody that is active. For example, if you are diabetic and you are on anti-diabetic drug and you are driving, it is good that you keep some cubes of sugar in your car, or you keep a mineral like Sprite in your car, so that when you start feeling these signs of hypoglycemia, you can easily take this like a cube of sugar or the Sprite, in order to raise the blood sugar level to the extent that it can stop manifesting those adverse effects. So diabetes is actually a very dangerous disease, and there are many people who have been on anti-diabetic drugs for a very long time, and there are also adverse effects that are related to anti-diabetic drugs, such as the deterioration of the liver and the kidney. So when somebody is taking anti-diabetic drug, it is also very important that the person take drugs that protect the liver and the kidney, so that the person will not develop a liver problem or kidney problem on the long run. So there are drugs that helps in protecting the liver and the kidney, such as Libolin, such as Legares, such as the kidney defense, and so on and so forth. So I advise people who are on anti-diabetic drugs to take precaution. Also, high blood sugar level can lead to erectile dysfunction, which is inability for a man to perform, because there is no enough blood that gets to penile area. Enough blood must get to the penile area in order for somebody to perform efficiently. But in a situation whereby enough blood is not getting there, or enough nutrient is not getting there, the person can hardly perform. And there are also other signs like frequent urination, and there are also other signs like protein in the urine. In olden days, one of the way that people check if they have sugar is that they can urinate on the ground, and they will leave it for some time. When they come back, if ants has gathered around the urine, they will know that they have a sugar. But if ants has not gathered around the urine, they will assume that they don't have a high blood sugar level. But that is for olden days. That is archaic now. That is out of context for now. So I want to encourage everybody that are diabetic to take precaution. You take precaution. If you are diabetic, it's not good that you continue smoking or you drink a lot of alcohol, because all these things, they tend to aggravate the side effect of the drugs that you are taking, and they also tend to aggravate the deterioration of the kidney, the liver, and the pancreas, which produces the insulin. So these are some of the precautions that must be taken in order to manage the diabetes very well. And in this forum, we are very much interested in protecting our patients, giving them the best management, so that they cannot, so that some of these side effects will not come to them on the long run. So I thank you for listening to this brief lecture. I will also bring you another lecture on diabetes, but if you have any question to ask, you can chat me privately to ask me your questions, and God grace, I will give you a sufficient and understandable answer to your questions. Thank you very much, and God bless you. Amen. I remain pharmacist Kenneth. Thank you very much.